Right, hi! I'm Monika. We're going to be talking about one of my favorite topics, so reptiles. Bear with me, I am not very good at this, but we'll get there. So we'll talk about most commonly seen health issues in reptiles, and we're going to be focusing on the husbandry side of it. So yeah, reptiles. Now, are you seeing reptiles? You guys, yeah? So what are like the most common species you see of reptiles at your practices? If you do see any bearded dragons? Yeah? Anything more exciting? Because that's what I figure is going to be the most common. Chameleons? Tortoises? Tortoises, yeah? Great. So the things that we need to consider when keeping reptiles. So this is all coming from your clients. So in order to prevent some of those issues, you have to talk to your clients and obviously discuss those things that we need to consider when keeping them in captivity. So the heat source, so the gradient of temperatures, UVB light, that needs to be appropriate to the species as well. Humidity, again, appropriate to the species. Diet, again, the same. Supplementation, so the size and type of enclosure that they're in, because obviously we don't want a tortoise to be in the enclosure that's just 4 times the size of it, because it can literally turn around. We do not want that. And then is it a group, or does the species live in a group or solitary in like natural habitat? So it's everything that you just need to investigate, really. So obviously I understand when it's not your pet, you're not going to just know everything, because you cannot know all the reptile species by heart. But it's something you need to look into, maybe try to help your clients, because it's all about their creatures. Environmental enrichment, that's a fun one. Be creative, that's like whole another topic. And other animals in the household. So obviously we're not encouraging people who have dogs or cats to let tortoise wander around next to your dog, because then you're going to have a tortoise with holes in the shells, or you're not going to have a tortoise anymore, or anything can happen, really. So as we all know, reptiles cannot keep their body temperature on their own, so they need that external heating, and in order to maintain their optimal organ function, metabolism, and all these processes going on, they need to stay within their preferred optimum temperature zone. There were lots of researches done in that topic, and when I say preferred optimum temperature zone, there's always going to be the bottom line and a higher line. And the research has actually shown, as far as I've looked into like multiple papers, that it doesn't matter if it's in the lowest point or the highest point, the metabolism is going to be similar, so the drugs will be metabolized in a similar way, but it needs to be in that gradient of the preferred optimum temperature zone. So humidity, so you have a little enclosure of one of my chameleons with the humidifier working. You have to know which species we prefer which humidity, so your Mediterranean arid climates will probably be in a lower one, like 25-50, but species specific, so you have to check it. Deserts can tolerate lower humidity levels, but the tropical species will obviously be on a higher end of our humidity. That's just a picture of a tortoise loving bashing through his enclosure, and some plants, weeds, that are being washed to feed the tortoises later. So yeah, please do encourage your tortoise owners to just go weed picking, not buy a salad from a supermarket, because that doesn't have much nutrition. Right, so what we're going to be focusing on today, the most common diseases that arise from the bad husbandry, poor husbandry, is our dysbiosis, liver disease, renal disease, MBD, dystocia, and we're going to touch on anorexia as well, because that's going to include all the supportive care. So the ecdysis is the process where we probably all know that, where the reptiles are changing their skin. So there's like a fluid coming in between 2 layers of the skin, the old one and the new one. It's got lymph and enzymes inside of it. Once the skin is lifted and separated, the old skin will peel off. That's the whole process can take like 3 to 7 days. The reptile will look dull or sometimes bluish even when you look at it. That means it's going through that process. There's very often snakes and some lizards who don't have eyelids that you'll see the blue around the eyes. That means it's going through the shed. So that's generally it. It's the whole process of losing skin. And the sarcoidosis is it's when it fails. It's when it goes wrong. And there could be many reasons for that. Most often is dehydration. I just put it later on, so I'll show you. Let's go through the pictures and we'll talk about the reasons in a minute. So that's your skin, snake skin shed. They normally shed it in either one big piece, or they can shed it in like few bits. That can happen, but this is something we do not want to see. That's an issue with your shed, with your patient's shed. That's a baby chameleon going through her shed. They tend to flake. Lizards, sometimes they tend to flake their skin off, especially chameleons, so it just comes in like little bits. So the common causes for our sarcoidosis would be the dehydration, stress, excessive handling when you have species who are super fragile and they're like horrified, like Erica was saying, the teeny weeny ones, they can have issues after that. 2, low environmental humidity and ectoparasites sometimes. Yes, please do not rip the skin off your reptile if it's struggling to shed it. It is not a good solution, so never do that. So you can spray the animal regularly to help it shed if you cannot bathe it. You should increase the humidity. If you can bathe the reptile, because obviously it's not always possible, you can do lukewarm baths. You can put like cork bark and other like a little bit more rough objects in the enclosure so they can rub against it. Sometimes they rub against like vines, you know how they make them like they're a little bit like crusty, so the chameleons tend to just go and rub their whole body on it, and that helps them to shed that old skin. And if you really are struggling and your reptile's not doing well through the shed, you need to think about the supporting care. So to be honest, it can be avoided, and we have to remember that most of the time this is all coming from the husbandry. So if you reverse the issues that are there, so you need to take a good history from your clients and make sure you understand what is correct for that species, and then if you can correct that, they may not have any issues in the future. And there are just some cute pictures of reptiles bathing. You know, like snake, blue dragon, chameleon, there were tortoises, you know, just because we all love them. And then our liver disease or hepatic lipidosis. So our most common causes for that will be obesity, high-fat diet. It's specifically in like species like bearded dragons, when they meant to be changing their diet gradually as they grow. So your bearded dragons will be more, herbivorous as they get older. So if you have a bearded dragon that's been fed loads of like insects and let's say like mealworms, super fatty, Mario worms, super fatty, and they've not been reversing the diet into more herbivorous, with the time it can affect its liver. So yeah, so we have to remember that. So at the age of 2, bearded dragons are gonna have like 20% diet of bugs. The rest of it should be pretty weeds or something greeny, leafy, that's appropriate. It can have also bacterial or viral cause. We're not going to touch on that today because we're doing husbandry related. And it can be secondary to reproductive tract disease with the pre-ovulatory stasis. That's one of the geckos I received from a breeder. Just as an example, he was a little chunky boy, so that could be potentially an issue in the future. So his fat pads are huge. You can see a little wrinkles there. I found some body condition scoring pictures online as well, so you can see how the bearded dragon should look like. Number 3, if someone doesn't know. The same with the leopard gecko. We do not want them too chunky. So just, keep that in mind. They do have a chunkier tail, but they should not look like this. It's just slightly chunkier. Right, and then the symptoms of our liver disease would be anorexia, jaundice. They have very often yellow or green, predominantly green colored urates when they go to the toilet, gradual weight loss. I know I said that. So they initially, when they overweight and it affects their liver, and then they stop eating because they're feeling so crap, and they, the liver's not working as it should be because it loses its function. So then they start losing weight. Lethargy, when they start regurgitating, that's normally not a very good prognosis. We can do ultrasound with reptiles. Yeah, maybe you'll see if it's enlarged a lot, but biopsies, great, especially if you're doing something else. And let's say your patient's stable enough and it needs a surgical procedure, you can do liver biopsies at the same time. Just send it up if you're concerned about it. Blood tests, and obviously we're watching the clinical symptoms, and we're trying to see like the mucous membranes, if they're a bit yellow, if there's something going on. You can always put this all together. With the treatment, we're obviously looking at the supportive care with fluid therapy, correcting the nutritional imbalances. If the animal is sick, obviously we all know we're not going to be just changing diets straight away, but we have to gradually, we have to talk to the client, explain everything, and try to trick it. There's so many ways you can do that. To just change the diet. That I have been through that with all the rescue tortoises. That is pain in the ass, but it is possible. You've got silamarine supplementation, that the milk thistle extract. You can get the liquids, you can get the capsules, whatever works. Just put it in your reptile to help its liver to function. You can use L-carnitine supplementation additionally, and appropriate diet. That's like the main one. Right, renal disease and gout. So we probably all know that the main excretory product of the protein in reptiles metabolism is uric acid. That's what we're looking for, and it's poorly soluble by water. So if you have dehydrated patient, the excess of that will start forming crystals, and it's going to come out of the solution. So it's going to start getting stuck to your either internal organs, which is going to be visceral gout, or it's going to start accumulating in the reptile joints, which is your articular gout. The main factors that will contribute to that is your high protein diet again, especially when it's fed to herbivorous reptiles. So, this clients where they come with a tortoise and they, feed them fruits, and, they Mediterranean species, they eat plants, but they really not, because they eat so much crap at home that the diet starts to changing, the protein build up, and it just hits their kidneys. The excessive level of vitamin D3, yes, it's good in moderation, but you can overdo it. Dehydration, that's a main one, I think. So you have to make sure your reptile has access to fresh water, and you can bathe the reptiles as well. Some parasitic burden sometimes can lead to necrosis or a damage to the kidneys, and some nephrotoxic drugs, if you use in some of the species, can do that as well. The typical signs would be your lethargy, PUPD, the retention of fluids. In case of rhinomagaly, sometimes you get obstipation in your reptiles, so that would be like your first reported symptom by the client. They would say, "Oh, my lizard's trying to go to the toilet, but I cannot." So then you can try to investigate further and see if there's something else going on. And visceral articular gout, which happens quite often when it's an advanced kidney damage stage. Diagnostics would include blood tests, endoscopy with biopsies, X-rays. If you have an experienced vet as Kev, maybe it's going to be helpful. Not everybody will see something on X-rays, I think, with kidney disease, unless it's gout, so then you can see the accumulation of the uric acid in your joints. And ultrasound, you can, well, if I was Kevin, I would probably, but otherwise. Supportive care, yeah, the treatment, obviously the gout, so the progress of the gout is irreversible. So whatever is stuck in your joints, in your reptile joints, you cannot take that back anymore because it's not going to be able to excrete it. You can put your reptile on allopurinol orally. I'm not giving those because it really varies and you have to assess it. You're probably better off doing blood tests, checking the clinical signs, doing the whole investigation, and then getting that dose right for the specific pets. You probably will want to repeat the blood test anyway to see if it's appropriately balanced. You can calcium gluconate. That's just because it's only put in there because of the calcium phosphorus ratio in the reptile. So as you know, it has to be like a stable amount of it in the body. And if you overdo phosphorus, then your calcium drops down. And if you supplement your calcium, you're trying to build it up, and then the phosphorus will drop down. So hopefully that will help the kidneys a little bit more. Yeah, but the significance will rise in your blood sample of uric acid will be when there's a huge damage in the kidneys. And we have to remember the carnivorous species like snakes, they will have elevated uric acid after eating, because obviously high protein food. So you have to always find out from your clients when was the last time the snake has eaten, because you can have false results. Right, metabolic bone disease. So we have the reasons for that would be your calcium deficiency, D3 deficiency, which is all related, UVB deficiency, which is related to that, inappropriate calcium phosphorus ratio, which I just mentioned. So the predisposed ones would be your youngsters growing up, or your breeding animals, because they obviously use more of that. So that can lead to your nutritional secondary hyperparathyroidism. The bones are weak and deformed. They're more prone to fractures. Sometimes you can see the lizards with they have arched both legs. They cannot support themselves because the skeleton is not strong enough. It's so sad. The tortoises will have softening and pyramiding of the shells, seizures, lethargy, anorexia, death, unfortunately. Yeah, okay, so the calcium supplementation is critical. It is important for the growing animals and the breeding females, mostly. The adult reptiles who are on an appropriate diet, you want to supplement it once, twice weekly. We don't want to overdo it either. Gut loading insects. So with that, you have to remember you need to gut load them 24 to 48 hours before you feed them to your reptiles, but you do not want to gut load the whole lot, because you're just going to kill all of them, because you're going to feed all the locusts with loads of calcium, and they're not going to make it. So you just have to put a little pot of food that you're going to be feeding the next day, give them loads of calcium with food, gut load them, give it to the creature. Yeah, it's just how it works. That they will not make it if you just fill them up for a very long period of time with calcium. UVB, yeah, indoors obviously. If we have a possibility to give them natural sunlight, yes, the answer is always yes, do it. Don't let them be too cold though. So Scotland is not very, it's not a very good place for reptiles, I'm afraid, but we still love them. Yeah, and diets containing high amounts of oxalates, so the spinach, beetroot, and other stuff like that. We're avoiding those. So we're correcting the food. We're not always doing calcium injections, only for those collapse or seizuring animals to correct it, but long term we're looking at dietary changes. The UVB. Euthanasia is a form of treatment in that case, because some cases you cannot do much more for them, and it's just a kinder way for them. There is a website if you're not sure what your reptiles should have UVB light wise, then you can go to the lighting guide. Arcadia's got one. There's loads of brands that uses that, and you can type your reptile species and they will show you which percentage of your UVB lighting is appropriate for that species. Okay, so now dystocia and follicular stasis, I'm sorry. So we also have dietary issues, because this whole topic is dietary issues. Hypocalcemia, MBD can cause that. Stress, you have no nesting material. Dehydration, that also can cause issues with laying the eggs. So the pre-ovulatory stasis is the one when their follicles are getting bigger and they cannot be excreted, so they fill the whole coelomic cavity and they put pressure on the organs and the lungs. And it's a huge discomfort. Animals very, very often don't eat at that point, because like you can't physically push anything through there, because they don't have diaphragm, so it's all filled up with it. So the lethargy, anorexia, they struggle to move. You can see the breathing is deteriorating. It can lead to hepatic lipidosis as well, and it can eventually kill the creature. Ultrasound, you can see the follicles on the ultrasound. You can take X-rays. You can see sometimes when it's like filling up the coelomic cavity if it's really advanced, and the blood test really to assess how advanced is the deterioration process. Post-ovulatory stasis, that's your dystocia. So when they have eggs already in shells and they cannot lay them, again, the same symptoms. They just try to strain and lay the eggs. So that's a bearded dragon with pre-ovulatory stasis. That's all the follicles that came out of him, of her. And that's a frilled lizard. There's an X-ray with the eggs inside of her coelomic cavity. That's just extra chameleons. Right, and the anorexia, that's the last one. It's not a disease, obviously. It's secondary to all the other conditions we've mentioned, but you're going to see reptiles suffering from anorexia. It can be environmental or medical. On that picture, you can see a tortoise. There's like suffering from a bit of a weight loss. You can see the gap on top of the head. I could not find it, but when we took his X-rays, you could push his head really far into the shell, because it was like mainly empty, because he was suffering from such a big weight loss. So the environmental causes of the anorexia will be the low temperature, low humidity, stress from handling, overcrowding. Oh my God, people do that a lot. You'll see breeders keeping males and females together, and the males harassing the female, and she just stops eating and she's upset and stuff like that. It just all leads to that. Lack of hiding area, the diet, and obviously UVB and that. Then medical causes are bacterial or viral. Parasites, foreign body, can be caused by stomatitis, gastroenteritis, the renal liver MBD, so the stuff we spoke about, and then neoplasia as well. For the supportive care, you want to provide fluid therapy to your reptiles, so that would be 25 mils per kilo per day. There's just like a little chart that tells you roughly what percentage of the hydration they're suffering from, so you can assess them as well. You can do subca fluids. That's actually an example of intraosseous catheter in a bearded dragon, but that dragon is really collapsed. Subca fluids will go where, the flaps of skin flaps, as you would normally in other species as well. Supportive feeding, depending on if your reptiles, omnivorous, carnivorous, herbivorous, there are adequate there's adequate food available. You can place a feeding tube especially in tortoises, and it's really easy to provide them with extra nutrition that way. And please do not forget about pain relief, because that makes a huge difference in reptiles, and they do have receptors as we do, and they can feel pain. And just because you cannot hear them screaming, that doesn't mean they're not in pain. This is the same patient. This is the patient on admission. This is a few hours after Kev has given it morphine. You can see the body language has changed so dramatically. It's just, you need to always consider pain relief for this guy. So we can use butorphanol, we can use morphine, we can use tramadol. Gabapentin is questionable, but I have used it myself on my tortoise and I think it works. Boop, forget about it. I can't go into depth, I don't have time for that, but we can use also local anesthetics, super handy. Always go for locals if you're having any procedure, minor thing, just do lidocaine, bupivacaine. You can use meloxicam if the kidneys are obviously functioning okay. And that's about it. Thank you.